Our top story this half hour, a new long-term weight loss drug will finally be available for patients' use next week, nearly a year after receiving FDA approval. Belviq is the first new drug approved for weight loss in over a decade. Joining us with more is CBS News medical contributor, Dr. Holly Phillips. Doctor, welcome.
Good morning, Anthony.
So this is fascinating to me because this one actually gives you some sense of satiety. You feel fuller if you take this drug. Am I understanding that correctly?
You really do. You know, this drug has an unusual mechanism of action for a diet drug. It acts on serotonin receptors in the brain. Those are neurotransmitters that are linked with, as you just said, satiety. So it makes you feel full, and hence you eat less, and then we see the weight loss.
Can anyone take this drug?
No, it's for a very specific group of people, and two groups in particular. The first is people who are obese. That means your body mass index is 30 or higher. The second group is for people who are overweight, but with one weight-related condition. So overweight, your body mass index is 27 or higher, but you also have something related to your weight, whether it's high blood pressure, high cholesterol, or diabetes.
Everyone always wants to know how effective is it. So how effective is it?
It is effective. In most people who took the drug as compared to placebo, they lost 3 to 3.7% of their body weight over the course of a year. It was slightly more effective in non-diabetics, people who did not have diabetes. They lost about 5% of their body weight. So this is not a miracle cure for obesity, but we really have to look at it from a health perspective, where if you lose 5% of your body weight and you are obese, it can truly benefit your health. You can require less medication for diabetes, your knees can benefit, your cholesterol, your heart, all of it can benefit, even just from a small amount of weight loss.
This drug was approved last June, so why did it take so long to get here?
It's a good question, Anthony. It really had to do with a lot of logistics around production, but the biggest issue was the DEA and how it was going to be what we call classified. It's now known as a Schedule 4 controlled substance, which means it does have the potential for abuse, but a low potential for abuse.
Whenever people think of weight loss drugs, people think of them something like fen-phen, and we think heart valve problems. Are there any side effects with the use of Belviq?
Right. Well, every drug has side effects. This one has headache, fatigue, dizziness, nausea, and in diabetics it can cause low blood sugar. But I think part of the reason that it took so long to approve a diet drug is that the FDA wanted to be very sure this would not be another fen-phen. Overall, the drug is safe, and it's shown to be pretty effective.
A long time since we had one of these. Dr. Holly Phillips, thank you very much.